Dane, we've got to stop this pie monster!
But I love pie!
Naturally Super is the greatest TV show of all time.
It is. It's also making me really want pie.
My name is Morgan, and this is my mom. You wouldn't know it to look at her, but she's got something called MS. Some days like today, I completely forget she's sick and everything seems normal. Other days, I'm reminded things are far from normal.
Hey, hon. I know your friends were supposed to come over for a movie night, but I'm not feeling so good today. Can you call them and reschedule?
Oh, yeah. Sure, Mom. No worries. You just rest.
Oh, you're the best. I'm gonna go lie down.
I never know how to explain to my friends why they can't come over. I barely understand why. I mean, how do you explain something as complicated as MS?
You literally just described my job.
Axon? Abacus? What am I doing here?
You need help understanding MS, right? Well, I just happen to be an expert on MS, and millions of other things, but let's stay focused here.
Hey, if this will help me understand what Mom's going through, then I'm totally in.
Love that attitude. Want to bottle and sell that attitude. Multiple sclerosis is often called MS for short. MS is a disease of the central nervous system, or CNS, which is made up of your brain and spinal cord.
Coordinates locked. Engaging teleporter.
Whoa, where are we?
We're inside Myelin, a planet that works and looks just like the human body. Now, to be specific, we're standing on a nerve. Did you think I was just going to show you diagrams all day? That's boring, and I don't do boring. Nerves are like wires inside your body that send and receive messages. This is how the CNS does its job.
What exactly is its job?
The CNS works hard to help you do important things like thinking, feeling, seeing, hearing, talking, and moving.
Have a look. See all those guys zipping around? Those are messengers. They carry the messages that travel from your brain through your spinal cord, telling your body what to do. Messages to your brain give it information on the world around you. In MS, the nerves in the CNS get damaged. Nerves are wrapped in a protective covering called myelin. Myelin helps to make sure messages sent through the nerves get to where they need to go.
Well, everything looks fine to me.
Oh no, don't say that. On Myelin, that's like being in a horror movie and saying, "I'll be right back." Uh-oh, here comes the immune system.
Why is that bad? I learned about the immune system in school. The immune system cells find and destroy invaders, like germs. They're the good guys.
Normally, yes, but in MS, the immune system attacks the myelin protecting the nerves in the CNS.
What? Why?
We don't know, but we do know it causes lots of problems in the body.
I think that Myelin over there just stuck its tongue out at me. Attack!
I'm pretty sure Myelin doesn't have a tongue. But attack anyway!
What's happening?
When the myelin is damaged, messages can't be delivered properly through the damaged nerves. Sometimes the messages get lost completely.
When this happens, the brain may have difficulty sending messages to the body. The brain may have trouble receiving messages too.
Sir, the hands aren't responding. Scratching powers are down. If we can't scratch, then the itch wins. The itch wins.
When nerves are damaged in MS, this causes symptoms, which are problems that can happen all over your body depending on where the nerve damage is. Symptoms can come and go. When they come back, it's called a relapse or an MS attack. Here are some MS symptoms.
Unsteadiness and feeling very tired, sad, or forgetful. Problems with feeling sensations and seeing. Numbness in legs or arms, as well as the sensation of pins and needles. Bowel and bladder problems. Problems walking and moving other parts of the body.
Wow, MS can cause a lot of damage.
Unfortunately, yes. There are different types of MS. In the most common type, symptoms get worse and then get better.
But for some people with MS, the condition slowly gets worse over time.
Isn't there anything we can do?
Absolutely. While there is no cure for MS just yet, There are treatments for relapsing MS that can help your mom feel better. The doctors will help your mom figure out which treatment is best for her. It's time to treat Mediland. Steroids help calm the immune system during an attack to help symptoms go away faster and make your mom feel better.
Anyone else totally feel like not making war and instead making pie?
Yes, make pie, not war is my new life motto.
Whoa, we've got incoming and I'm out of steroids.
Lucky for us, there are other treatments for relapsing MS, like disease-modifying therapies, or DMTs. Don't throw until you can see the white of their cells. Get it? They're white blood cells.
Joke analyzed. Joke found statistically unfunny.
Ready? Aim, throw! DMTs help reduce the number of MS attacks by blocking the immune system from damaging the nerves.
No more unnecessary destruction for you guys.
But we love unnecessary destruction.
Treatment with a DMT is usually started right away, before the immune system has done too much damage.
In addition to the benefits of these treatments, it also involves risks. Your mom's healthcare team will evaluate the benefit versus risk.
Mediland's MS is under control for now. Let's head back to HQ.
Is there anything else Mom can do besides take medicine to help with her MS?
Indeed. Things like exercise, eating lots of fruits and vegetables, and getting enough rest can also help your mom feel better.
People with MS sometimes get physiotherapy and massages to help reduce their symptoms.
I really appreciate you teaching me about my mom's MS. It totally helps me understand what she's going through, but it's still just hard.
I totally know. Having MS isn't just hard on your mom, but also on you.
It's weird. It's like every other day I feel something different. Some days, when I think about my mom's MS, I get sad or mad. But on others, I get worried and just feel so alone.
That's not weird at all. Everyone deals with MS in their own way. You have to allow yourself to feel however you feel. Don't try to hide or ignore it.
I know I shouldn't, but some days I get mad at her because she can't do things my friends' moms can do. And on days where she has to use her cane or wheelchair to get around, I get embarrassed.
It's okay to feel those things. That's totally normal and doesn't mean you love her any less. Living with MS is difficult because it can be unpredictable. You never know when your mom's gonna have a good day or a bad one. But your mom isn't alone. A team of healthcare specialists, including a psychologist, is there to support her whenever she needs it. Here's the thing I need you to remember. You aren't alone either. Many families are going through the same thing as you, and there are programs and services available to help you and your family cope with living with MS.
Thanks, Axon. And you know, even on the hard days, I always feel happy just getting to spend time with my mom. She's my hero. Okay, I learned a lot today. Let's make sure I've got it all down. MS is a disease that affects the nerves of the CNS. Nerves carry messages to and from your brain. In MS, nerves get damaged and this can cause problems like trouble walking, seeing, and feeling. Although there is no cure for MS, there are treatments to help my mom feel better. MS can be hard on my mom and on my family, but we're not alone. There are lots of people who can help and support us.
10 out of 10, smiley face emoji. Now that you're an MS expert, I'll give you this Medicron, a computer with everything you learned on it so you can teach others too. Now, time to send you back home.
A few minutes later.
You rest up, Mom. I'll be here when you wake up, and every day after. When your parent is sick, it's hard.
A few days later.
So MS affects the nerves, but it helps if you and the people you care about understand what they're going through.
The next week at movie night.
The most important thing I discovered is to focus on the good times and to remember that even in the bad times, you are never alone.